Hi, my name is Courtney Deitch, and I'm with Honeysuckle and Pearl in Lake Charles, Louisiana. And today I have Cindel Granger with Love in the Making. She is a local midwife to our area, and I wanted to talk to her about a few things. So cord clamping, cord care, baths after having a baby, because those are some things I get questions about all the time, and it might be a little bit different than you were told in the hospital or by your doctor. And moms that are treated like this, umbilical cords come off so much faster and dry out and do so much better. So, Cindel, tell me a little bit about how you do cord clamping and what are the benefits of delayed cord clamping.
Well, first of all, thanks so much for having me.
Oh, you're welcome.
Yeah, so the benefits of delayed cord clamping. So those benefits are pretty endless. I could talk about that for a while.
Okay.
But let's see. So starting out, 40% of baby's blood is still in the placenta. So the longer we delay cord clamping, the more baby gets its own blood, the more baby gets stem cells, the more baby gets oxygenation. And another thing that benefits mom, which a lot of people don't talk about, is when the placenta is able to empty the amount of its blood, it comes off easier from the uterus, from the uterine site. So Mom has less chance of retained placental fragments, less chance of extra bleeding following delivery. And we also don't pull on the cord. So all those things are less because of that as well. And we don't have to pull on the cord because
it naturally
detaches when it's left alone. So.
Okay. Perfect. Mm-hmm. So I know now, used to, back in the day when I was having my first babies, they told you alcohol to clean the umbilical site. Now they say do nothing and do not bathe your baby until the umbilical cord falls off. So I'm seeing it take a week, 2 weeks, a long time for these cords to fall out when it's handled that way, and moms want to bathe their babies. So tell me about how you do things that help speed this little process along.
So obviously there's nothing wrong with doing nothing.
Right.
Most of the time things fall off of their own. The cord falls off fine on its own. We don't have to do anything extra. However, I have found, and what I was taught in midwifery training was we use an herb called golden seal. And golden seal is very effective it's both antibacterial, antimicrobial, antiviral. I mean, it's super, super beneficial. But we will sprinkle a little bit of that onto the cord before we leave the house after the baby's born. And we find that the cord falls off in 3 to 5 days.
Yes.
The most a week. To where, and when you have a hospital delivery, most of the time it's anywhere, like Courtney said, from 2 to 3 weeks. We don't find babies have any infections. As far as the bath goes,
let me just stop you real quick. And it dries it out much faster. So it dries it out so you don't have that moist kind of.
Yeah, I'm kind of, I couldn't remember if you asked me about the bath yet. So,
I did. But
you?
It's okay. It's okay. So it just dries it out using that golden seal capsules, just a little bit of that powder. It just dries it out so much faster. So you don't have that moist kind of sticky that you get when you're kind of doing nothing.
Well, and also a lot of parents will call me as the cord is starting to come off, usually on day 3 or 4, and it's gooey, and they're kind of freaked out. And they're like, is something wrong? And what I always tell them is, open up your capsule, sprinkle it onto that gooey, and by the next day it's gone.
Yes.
Like it's fallen off.
Exactly.
So it really does do a good job at completely drying it up.
Yeah, now let's talk about baths.
Okay. So, they started in the hospital sponge bathing babies because they were worried that if the cord got wet, it would get infected, it wouldn't dry. Sponge baths were used because they wanted to protect baby from HIV. They thought that was a protective way to do that in the 80s, and honestly it doesn't really do that. We've also found that submersion baths are much more natural for baby. Babies hate sponge baths. So if you're ever at a hospital delivery and you see a baby getting a sponge bath, they're screaming.
Yes.
And they're upset. So what that does is that makes their blood sugar fall, because you know that.
Yep.
They're
Using
working
energy.
up all that energy. They're less likely to go to the breast because they're upset, they're tired. And so submersion baths aren't like that. Babies love them.
Yes.
Babies are relaxed. They honestly feel like they're back in the womb again, especially if they're with mom.
Exactly.
Yeah.
I love co-bathing.
Mm-hmm.
I love moms bathing with babies. Co-bathing is one of the best things you can do. It's just such a bonding and intimate time between moms and babies. And I use that a lot in my practice for babies that won't nurse or aren't nursing well. We go to co-bathing for that.
Okay.
Yeah. So that's
a great idea. Yeah. Honestly, babies usually go right to the breast as soon as mom gets in the tub, and they're warm and they're on mom, and they nurse a lot easily.
Yes.
And we also put herbs in our baths. So moms, like, this is if babies are doing well, you know, their temperature's regulated, their breathing's fine, mom's bleeding's under control. But with all those things involved, we give them the option of doing an herbal bath. And that not only helps mom heal if she has any vaginal lacerations, but it also helps the cord dry up quicker. So it's a second thing that we do. And I don't always recommend soap, because a lot of natural moms are worried about washing off, you know, the vernix, because it's so amazing. It's got so many good things in it. But they did a study on babies that were not bathed. They swabbed the skin for antibodies and all the great components that are found in vernix. And they did the swab, and then they did the swab on the babies after they were bathed in just an herbal bath, not soap. So these babies were not scrubbed.
Yes.
And the amount of beneficial bacteria and bad bacteria was exactly the same. So it didn't wipe off
any of the good benefits.
Things. Right. Obviously, your choice to bathe your baby is yours. If you want to wait 24 hours,
if
you want to wait a week, there's nothing wrong with it.
Exactly.
But,
you don't have to bathe immediately.
Right,
it doesn't have to be done in the hospital immediately.
Correct.
You can delay that.
But if it's something that you're excited about doing with your baby right after it's born, there's nothing wrong with it.
Yes. And regulate body temperature. If you're doing a sponge bath immediately after that baby's born, not only are we washing off that good vernix, we're also maybe losing some of that body temperature with a sponge bath.
Yeah. And it's not beneficial at all.
Yes. Okay. Well, thank you so much for joining me. This was fun.
Anytime. I loved it.
Okay. Thank you so much, Sindel.